insecurity and body dysmorphia runs rampant. And we both have young girls, and so I'm very cognizant of the fact that I don't want to portray that to my patients and my children, right? I want them to be strong, intellectually strong, and appreciate their own body. And I think that's a really important thing that we need to stress, especially nowadays with all this rampant bullshit that's going on with social media.
I like you guys a lot.
A lot of people do.
Just you're so personable. And the best part is I feel comfortable asking you all these questions because you're board certified plastic surgeons, which not everyone is out here in the streets of Beverly Hills.
That's right. The hood.
Yeah. But you are known for your high def body contouring and all the body work that you do.
Yes.
And you are an explant specialist and deep plane facelift specialist.
That's right. That's right.
But you guys do more than just that.
Oh, yeah. I mean, we do the whole gamut of plastic surgery. But again, when you're in a highly competitive market like Beverly Hills, you have to have a niche and something that you're an expert at. I'm an expert at facelifts. He's an expert at body contouring. And we're at the top of the food chain when it comes to those things.
Yeah, I've heard.
Yeah.
But I like that you guys also do surgeries together because I haven't heard of two surgeons working together in the way that you guys do. And it's not just one thing because you do the liposuction, the fat transfers, then you also do the facial rejuvenation and the nose jobs and all that. What are all the different combinations of surgeries that you guys do together?
There's a lot. And a lot of it has to do with logistics and timings, but I think the biggest thing that we get to offer patients is they get two specialists that focus in on certain areas that they love to work on, right? And so some of the combinations that we've done, so we've done, like you mentioned, deep plane facelift and rhinoplasty, right? I love to do noses. He loves to do the deep plane facelift, and it kind of comes together to work together nicely. The others that we do are the liposculpting and fat harvest. So I'll high definition liposculpt the body, highlight the patient's anatomy, give them pretty Pilates lines, really reduce the fat in the trouble areas, and then hand that fat over to Dr. Chopra, in which he transfers the fat into the breast or removes implants and transfers the fat into the breast. Another interesting combination that we've done a couple now is face and thighs, because some patients that are in the age range that it's ready to do facial rejuvenation, they get a little bit of loose or sagging skin on their inner thighs. And so that's an interesting complement because we can work at the same time. He's working at the head of the bed and I'm working down at the legs. We've also done face and tummy, and we've also done face and breast. And so there's been a couple of different combinations that we can do to kind of provide a total body rejuvenation at the same time. And it doesn't create two operations. It doesn't create two recoveries. We can do it all within a safe amount of operating time. And, it's really nice for the patients because they don't have to worry about it.
Yeah, I mean, I think the important thing is can Nate do all these procedures by himself? Yeah. Can I do them by myself? Yeah. But you want someone focused on that particular procedure. So you have an expert doing it, right? So there's guys in Beverly Hills and everywhere that do everything. And it's very difficult to be good at everything. You can be good at maybe one or two or three things, but you can't be good at everything. And so I think people need enough humility to realize that, listen, Nate's way better at doing the liposuction than I am. I'm way better at doing the facelift than he is. But we realize that. But I think most people need that humility to give the patient the best outcome. And that's really what it's all about.
I have a question. When people come to you guys, are you suggesting to them, hey, maybe you can consider this, or I have Nate work on this, or I have, Chopra working on this? Or is it that they're coming in with all of these concerns and you're like, hey, we can actually do those at the same time, so you don't have to come in twice, do anesthesia twice?
Yeah, I think it varies. Number one, I never really like to suggest something to the patient that they're not bringing up.
And I think that's where we're very, simpatico.
Yeah.
Because I think I'm the same exact way. I think people need to come for what they want to come, and you don't plant an idea because it is surgery. There are risks. And if you're putting somebody at a greater risk for something they never wanted, you're biting off more than they can chew. And I think that I agree with him 100% that we let them kind of decide what it is that they're there for.
I love that. Especially because girls are already so insecure because the beauty standards are actually insane. I mean, I'm sure a lot of women have come to you with requests that are a little outrageous, or you're so shocked because they're so beautiful and they're saying, hey, well, I want this, or like, you know, their arm is skinny and they're still like, well, no, I need it to be thinner, or whatever the thing is. But, you know, I've gone to other surgeons' offices where I just had a question about one thing and they would be like, well, actually, you know, the body is an illusion, and what you can do is you can actually remove fat over here and remove fat over here, and that'll tighten you up. And I wasn't even thinking that.
Yeah.
And I remember leaving feeling horribly.
Right.
You know, so I think it's a really great thing that you guys don't do that.
Well, I think definitely in LA, I mean, insecurity and body dysmorphia runs rampant. Right. And, you know, we both have young girls. And so I'm very cognizant of the fact that I don't want to portray that to my patients and my children, right? I want them to be strong, intellectually strong, and appreciate their own body. And I think that's a really important thing that we need to stress, especially nowadays with all this rampant bullshit that's going on with social media.
Yeah.
Yeah, and adding to that, I think the social media nonsense of fillers and body filters and things like that are creating this perception that is not reality. Listen, I have a lot of patients that are influencers that look incredible. They come in, they're in wonderful shape, but you see their photos online and they're touched up. And it's like, how does this person that's already fit and look incredible get more filtering and extra things added to them to look essentially non-existent, non-real, right? They create proportions that don't exist in reality. And then it creates this standard that other folks that are not in this world, that are laymen, that are working in, you know, the regular world, that are not in this, you know, LA, you know, influencer world, that don't understand what goes on behind the scenes to create those posts, then expect to get this non-realistic result. And it kind of creates a big challenge. And so I also think about it myself because I have a young daughter, and I definitely want to help patients achieve what they can in order to navigate this world as comfortably as possible, but also not set an unrealistic expectation for them that they didn't have when they were coming in. You know?
Yeah. Yeah, so it's not only the plastic surgery, it is also the filtering and the editing and the bringing the arms and the waist and stuff 100%. And I see it all the time, and I never know what's real or there's no way to really tell unless like in a picture you see the waves. When people
I've seen that.
Where I'm just like, you need to work
nowadays
on that.
with AI, a lot of people are getting caught, and it's getting all over the internet and media in terms of who's doing it, and they're getting called out. Even Kate Middleton got called out.
Did she?
Yeah, she got caught up. It was one of her kids was edited in a photo. But it's, you know, every now and again you'll see something and people are keeping a closer eye on it. But it is happening rampantly, right?
Oh my God.
Yeah.
Do you feel like when people come in, are they asking you to look like a better version of themselves, or do you feel like they're asking you, I want to look like this girl? What are they coming to you with?
I think that's, you know, there's a lot of people, at least particularly for me, that comes in, oh, I want that fox eye look. Or I want to look like Bella Hadid, you know, because she has that.
Yes,
fox eye
and it was advertised that she had like over here cut and lifted or something.
That's right. Well, allegedly she kind of had that. But the question is that sometimes your anatomy won't be able to do that. But more importantly, you shouldn't be looking at somebody else and trying to compare yourself and trying to be like that. We're just trying to make you look like yourself, but just a better version, right? And that's a really important thing. And then I think it comes back to what you were saying. It's all about your self-esteem, right? Once you're comfortable in your own skin, you're like, yeah, I just want to be a better version of myself. And those are the type of patients I want. I don't want the patient who comes in and says, I want to look like somebody else.
Right.
Because that's just a red flag right
Yeah,
there.
you don't want the patient that comes in and no disrespect to the people that want this, but they're just not the right patients for us. That I want to look like Ken, I want to look like Barbie doll, I want, you know what I mean, right? Don't you agree? Like it's worrisome, right? But
Yeah, it
there
is.
are folks out there that exist. They're just not the right patients for us because it's not what we want to kind of portray to the world that that's how we work, right?
Right. And you can catch those patients on Botched.
Yeah, that's right. No, but I think it's important because really good plastic surgery is plastic surgery that nobody notices. They just be like, wow, you look great. They don't know why, because the human eye can pick up things very quickly when something's out of order. Even if your brows are too high, your face is too full, people can pick that up and be like, that's bad plastic surgery. I don't know what you did, but it's bad plastic surgery. I never want my patients to be able to tell that they've ever had plastic surgery.
Yeah.
That's it.
And I second that. The other thing too is that like with a lot of the procedures that I do, the high def liposculpting, in the acronyms that I gave to define them, it's anatomically true lipoaspiratory sculpting, which is the Atlas procedure that I do. The other one is the Atlantis, which is anatomically true lipoaspiration and transfer with sculpting.
What's the difference?
And so with the Atlas, we just do liposculpting, and the Atlantis, we liposculpt and we use the fat and we transfer it somewhere, either to breast or buttocks or both. And so in those procedures, the first two words are anatomically true, and that's anatomically true to the individual patient, right? I don't go and create fake abs. I go and highlight their natural Pilates lines. All you need to do is go to one bodybuilding show, right? And you see the leanest, fittest human beings on earth, and you look across that stage, both male and female, and you will see the variation in human anatomy that exists at that level. All the abs look different. It's almost like a fingerprint. And so a lot of times what we see in our field is we see a lot of people creating cookie cutter bodies, cookie cutter results. Everybody looks the same. And I think that that's where you start falling into that trap that the eye can notice. That's a BBL.
Yeah.
That's a lipo tummy. That looks fake. Those are fake abs, right? Like on dudes, I'm seeing it more frequently than not because more men are open to the idea of getting liposuction, and they look like these Lego brick abs that don't follow the anatomy or the overall physique. And so then you kind of get into this picture of that doesn't look good. That doesn't look natural. And so I do everything to avoid that.
And I think that was the old BBLs, right? There's girls rocking around with these huge asses. And that's not normal.
Yeah.
You have a thin waist and your ass is like this. That just doesn't look right.
Yeah.
Doesn't look proportionate. Doesn't look
How
pretty.
did that trend come about?
Well, we know how it came about.
Yeah.
Kim K, right?
Yeah.
But I mean, her proportions are a little different. But
But no, now
girls,
she changed it because
Okay, but see
allegedly
here.
she got
Okay, but allegedly she got one. Here's the thing. I've talked to so many surgeons who have said, I think you might have said this, that you can make your butt bigger, but you can't like lipo from your butt, or you shouldn't lipo from your butt, right?
Correct. Yeah.
Okay, so
you
what's-
can do some lipoing of the buttocks, but you have, like, if you take fat out of the buttocks, it's going to sag, right? The skin's going to sag. So you need to do something to tighten the skin. So you can do incremental reductions to the buttocks and do multiple operations to take out some fat, tighten the skin, take out some fat, tighten the skin. It's a process. It can't all be done in one shot. But you typically, if you're somebody that's never had any fat injected into the buttocks, just leave it alone. Right? You can, if you wanted to augment it or add some volume, that's fine. But to make a natural buttocks smaller, that's very challenging, right? I think is that what you're referring to?
I think so.
Yeah.
Yeah, but I mean, we don't know what Kim has or hasn't done.
Well, we do, but we can't say.
Well, I also know lots of surgeons and different doctors who work with her and have gotten successful because of associations to her. And again, we don't know what she is. I don't.
Right.
The average person doesn't know what she is or isn't doing.
Yeah.
Right.
So, and then, you introduce Ozempic, and now we have all these things. It used to be just. We had Jenny Craig and these weight loss supplements and whatever. Now it's like,
back in the day.
What was it?
Fen.
Yeah.
I don't know.
It's phentermine.
Yeah, you do.
Oh, yeah, phentermine. Yeah. Okay, you had all of that. And then now it's like the liposculpting, the Ozempic,
Yeah.
the this, the that. It's like, what's going on?
Right.
You know?
Yeah, I mean, I think our society needs to sort of bring it back a little bit. We're going to these outer limits where, listen, Ozempic's a great drug for people who have diabetes and things like that. And I think it can be used as a good weight loss drug, but under the right circumstances. I mean, you have these young women that are taking it who are already skinny that want to lose like 5 or 10 pounds or whatever they want to lose. And this overall, it's just not a great way for your body to react, right? You should be on a good diet. You should be exercising, sleeping right, drinking water, doing all the normal things, as opposed to taking this drug to make you lose 5 or 10 pounds, right? That's the wrong application for the drug, in my opinion.
Yeah, I also want to add, the biggest thing that people are seeing with Ozempic is they're seeing weight loss. But the weight loss is not just fat, it's soft tissue. So that means there's bone loss, there's muscle loss, and the muscle loss is actually really, really critical because your resting metabolic rate, so the amount of calories that your body spends at rest, is dependent on your total lean muscle mass of your body, right? So more muscle mass, your body spends more calories. Less muscle mass, your body spends less calories, right? And so you get these lean and thin patients, right, that already have a little bit of muscle mass and not that much fat, and now they're reducing more of their muscle mass than they are their actual fat, and so the scale goes down. They look thinner, but now their resting metabolic rate is lower because they are spending less calories, and or they need less calories. So the second they get off that drug and start eating again, then they're replacing that muscle mass with fat, right? And that's where you start to have some of these issues that we see. And so I think, number one, the guidance of somebody that really understands the drug is critical. And also having, it's not just a doc that can prescribe, it's also having somebody that can guide your nutrition, that can guide your physical fitness, I think is a critical component that nobody's talking about. I've rarely heard people talking about the fact that you need to lift weights, you need to maintain that lean muscle mass if you're going to be taking any of these semi-glutides because of this muscle loss.
But also in general, that you need to be
100%.
lifting
Yeah.
weights and stuff, and how much it affects the brain.
That's right.
I mean, I'm just
1000%.
learning about that.
Yes.
I mean,
Yes.
exercise, if you look at it, is probably the best thing that we have for depression, for bone density, for your heart. That is probably the best thing we have, you know, and most of us just don't do it. I mean, it is incrementally better than diet, even though diet's very important, but it's, what is it, 6 to 10 times more important for you to exercise as you get older as opposed to your diet.
Right.
Yeah.
And then the other thing too, in terms of age and longevity, your functional strength, like to be able to get out of a chair, to be able to like open the door. Like a lot of young folks don't think about this, right? And it's fine because you don't need to. But as you continue to age, that functional strength actually turns into how long you live, right? And the number one thing that causes men to die early are fractures, like hip fractures and things like that, because they're not moving after that. And that leads to them dying earlier than folks that are fit, mobile, those you see people living a lot longer. And so all of this comes together, right? Like a lot of folks now are just thinking about, oh, I'm going to lose weight in my 20s or 30s with Ozempic and I'm good. But we still don't know the lifelong implications of this, especially when we're talking about lean muscle mass, which I think is really, really important.
I love that you guys talk about that stuff.
Yeah.
Because nobody's thinking long term.
Yeah.
Something else that I like, I know that you guys do explant procedures together with,
Yes.
and you know the fat transfer to the breast and all that.
Yeah.
Ritu, I know you don't do implants at all.
No,
And,
so go ahead.
and sorry, and you won't do them for certain patients. So I wanted to ask you first, why don't you do them at all?
Yeah, so about 6 years ago, I had a patient who came to me after I did her augmentation, like 2 or 3 years later, and said, I just don't feel good. I went to my rheumatologist, and they think it's the implants. And, you know, for full disclosure, we weren't taught that the implants were dangerous or anything like that in medical school and in our residency and things like that. The implants have been on and off the market in the 80s because they were causing some problems. They did some studies and they found out that the implants were what they called, quote, safe. But I started seeing a lot of women come in with what we call breast implant illness, which is a constellation of symptoms from, nerve pain, hair loss, fatigue, anxiety, a bunch of these sort of non-specific things. But they've done all these tests and they don't have anything else to sort of put the finger to except their implants. And so they're feeling so sick that they're willing to undergo an explant, taking out the implants, taking out the scar tissue around it, just to feel better. And what I found is that I was getting so many of these patients, and I'm like, I can't be putting these implants in and then taking them out of women, right? If I really believe in breast implant illness, which I do, I need to choose a side, and the side I chose was, trying to help these women because I didn't know the women that were going to get breast implant illness by putting the implants. There's no test for it. So I stopped doing it, and I've continued to not put in implants.
How often do women come in asking for them?
Implants?
Or they know not to?
For me, they don't know. They know not to anymore.
Right.
Yeah.
I don't do them anymore. So
Yeah.
they know. But, for a while, in the beginning of my career, I did a lot because I didn't know. But now that I know, and it's not everybody that's going to react. It's not everybody. And I think the biggest thing, which me and Dr. V were talking about, is that as long as you give them full disclosure, as long as you tell them about it, like this is a possibility. Listen, you can do whatever you want to your body. You can smoke, you can do crack, you can do whatever, right? You can, right?
Yeah, you can.
Right. So as long as there's full disclosure and you know the possibilities, I think you're an adult. You can do whatever you want.
Yeah, and I think that's where, I do put in implants, right? And I think having a business partner that doesn't is a nice grounding force for me because I do believe breast implant illness is real. I do believe that those patients do get better by removing implants. Now, the caveat for me is that, as in everything in life, if you look at any drug on the market, there's going to be a percentage of people that have a bad reaction to that drug, and there's going to be a percentage of people that don't. And if the percentage of people that don't is much greater, and the benefit to that group that is much greater outweighs the risk to the people that have a reaction, then that drug is safe, it gets through the FDA, and it's approved, right? And we see this in all parts of medicine, and I think it holds true also with breast implants. I think there's a large population that has breast implants that exists that don't have any major issues, right? And it's safe, and it achieves those individuals' goals, which is to have a little bit more fullness, to feel more comfortable in their body. Whatever the motivating force, it checks that box, and that person navigates through this world happier because of those implants, right? Now, that being said, I do give everybody full disclosure. I had a couple of breast augmentation consultations today, and breast implant illness comes up routinely. And I think it's great about the advocacy that has been going on out there because more and more people are coming in because of whether it's social media, the internet, the TV, the news, whatever it is, podcasts, that people are obtaining information. They're knowing that breast implant illness exists, which I think is a step forward because the more information people have, the more opportunity they get to make the right choice for themselves, right? And like you said, you could do whatever you want. You could go smoke crack, right? Is that right for you?
Yeah.
I might just do it.
You could, but the question is that like, is that the right thing for you, right? And for a lot of people, it's no, right? And so I think understanding that, and I tell patients too, we don't have a test that we can be like, here's a gene array, your genes implants are bad for you. Your genes, you'll not have any issues with implants. Maybe at some point we'll get there because we're progressing through medicine in a way that could be in a foreseeable future, right? But as of now, the things that I use during my consultation, if somebody says they have autoimmune disease, lupus, rheumatoid arthritis, or they have any type of autoimmune hyperactivity, in those patients, I counsel them against putting in an implant. Because for as far as we know, even though we don't have a specific scientific diagnosis of this pathology, What we do know is that a lot of the things that we're seeing is inflammation. And what's responsible for inflammation in the body is your immune system. And if your immune system is hyperactive, it's going to become hyperactive to a lot of things. It's going to become hyperactive to implants. It's going to become hyperactive. And so in that case, I do everything to educate that patient, hey, you're at really high risk for this problem because this is a foreign body that I'm putting inside you, and your body's going to pay attention to it and not forget about it. Whereas in somebody that doesn't have a history of autoimmune disease, the risk of that goes down significantly, right? Now, the other thing that I think is really interesting in this whole conversation is that autoimmune disease typically doesn't present itself in women until they're early to mid 20s, right? And so in patients getting breast augmentation before that time range, they may not even know that they were at risk for autoimmune disease. And so in the younger patients, I have this conversation, right? Because we don't really know it's a possibility. And then I talk to them about what the solution would be. And I educate them I put the ball in my patient's court. I don't like to make decisions for my patients, right? That's because it's not fair. It's their body, right? My job as a surgeon is to provide them full disclosure. This can happen. Good, bad. Now you decide if this risk is worth it for you. And so that's how I approach it.
Yeah. I mean, I think we both agree that if you can do without a foreign body, if you can do fat transfer or a lift, that's probably the way to go.
That's what I was
100%.
gonna. That's what I was gonna ask about.
'Cause no one needs a foreign body in them.
Because I'll say this.
Yeah.
I know you're very popular for the fat transfer procedure. I've even heard like Dr. Ben Tale talk about how you're one of the best for breast fat transfer.
Yeah.
And what I wanted to ask was, can you get the same result or close as a breast implant, meaning size-wise? And what is that process like? Do people have to do it a couple times? Like, what is that like? Because you also do the explants and then you put fat back in. So does the skin stretch? Like, give me the whole...
Yeah, so you'll never get the same result you would get with an implant with fat grafting. Just because an implant's a round sphere, right? So it stays in your chest and it's a round sphere. So the breast tissue sort of molds around it. When you're doing fat grafting, you're grafting throughout the breast tissue. So it's going to be way more natural. The biggest difference is that upper pole fullness. When women don't have a lot of fullness up top, they have a little bit of a slope and they want that fullness, the only way you're going to get that is with an implant. That's the only way. If you want to go up in sizes, every time you do a fat graft, you can go up to about a half a size to a cup size bigger. So if you're starting on an A and want to go to a C, you're probably going to have to do 2 or 3 fat grafts. But, a lot of people don't have that much fat on them, right? So that's the issue. And so people have to be really aware what fat grafting can do and what it can't do. It can't give you a lot of upper pole fullness, but it can give you enhancing your own natural shape. It can't make you look augmented, though.
Right, and I think to echo that, when I'm consulting with patients about breast augmentation, I do ask, to keep it simple. I just say, okay, what is your current cup size on average, and what is your goal cup size? If somebody says, I just want to be maybe a half a cup bigger with a little bit more fullness, but I like the shape of my breast, that's a wonderful candidate for a fat transfer. Mm-hmm. If somebody's like, I'm an A and I want to be a triple D or a double D, right?
God bless them.
Then there's no way I could do that with fat, right? And also, in the majority of patients that are A's or have smaller breasts, for the most part, the body fat percentage is typically a little lower, right? Now, there's variations to that and there's exceptions to that for sure. But the body fat is typically a little bit lower, so there's less of a source for us to harvest that fat to augment that breast. And those smaller breasts have tighter tissues. So if they've never been operated on, there's never been an implant in there, we have to expand that tissue. And that's where planning multiple operations to get some expansion and some stretching of the skin, coming back and doing it again and doing it again. And a lot of people don't have the time, the energy, or the money to go under multiple rounds to get this look. And so that's where a lot of this information is very relevant to an individual that's considering all of these options.
Okay, and then another question I had was, because I've seen you post about fat transfer to the face,
Yep.
you said it's better than filler.
Oh, yeah.
So
No
are
doubt.
people coming to you just for that? Or is it like during a fat transfer to the breast, you also take the fat and put it in their face? Like what's,
Yeah, so I think 100%, in my humble opinion, fat grafting is better than fillers for places that you want more structure and more fullness. Because fillers, number one, they say it lasts 3 to 6 months. It doesn't. It stays in there. It also blocks your lymphatics. So those two things for the long term isn't great. When you do fat or nano fat, not only does it can help your lymphatics, but it looks natural and it's part of you. And so if you're going to do areas that need volume, fat grafting is great. Judicious amount of fillers is fine. If you want a little bit here and there, that's great. The biostimulators like Radiesse and Sculptra, I think those have to be very judiciously, like in the temples and other places, that won't cause a big reaction, because I've seen over and over again when I'm doing facelifts and these people's had threads, Sculptra, Radiesse, it is a very difficult operation to do. The face doesn't move normally. I'm around the nerves and the injections and the threads are all around the facial nerves, so it makes it much more difficult and much more treacherous. I think fat is the way to go. If you're going to do filler, be very judicious and do it here and there. Don't get these big filler faces that, we saw Madonna have it before. We
Yeah.
see a lot of celebrities do that because they're going to dermatologists, which are fine, as opposed to a plastic surgeon. So if you're going to someone that can only fill you, they're only going to fill you. But as we age, three things happen. We lose the volume, which we use fat or fillers, the laxity, which we have to get out with a facelift, and finally the texture, the amount, how your skin looks. So all those three things happen when we age. And if we're only addressing one, like with filler, you're going to get a moon face. If we're only pulling you too tight, you're going to look like, that lion lady. Remember her? Yeah.
You look like you're putting your head out of the window of a moving car.
Yeah, you look like you're windswept.
Windswept.
So every single thing of aging has to be addressed to get a really nice, beautiful outcome.
okay, amazing. For the liposuction that you do,
Yes.
I hear you can only do like up to 10 pounds like,
Yeah. So it's not a law. It's a recommendation.
okay.
And I think this is a wise recommendation that 5 liters of liposuction is what you should limit to in the outpatient surgery setting, okay? And so 5 liters, there's 2.2 pounds per liter, so 10 pounds, that's an accurate representation of the amount that you can remove. Mm-hmm. Now, those 5 liters, you can go beyond that, but the recommendation is if you go beyond that, the patient needs to be monitored. And they need to be monitored in an aftercare with a nurse, watching their vital signs, making sure that there's an IV line and all of these things to make sure that the patient's safe. And the reason that 5 number exists is because once you start going over 5 liters of liposuction in an average human, right? Somebody that's average human, we're talking about somewhere between 130 to 160 pounds, 170 pounds in that weight range, anywhere from, 5'2" to 5'6", right? In that body frame, 5 liters, beyond that, your blood circulation starts to shift. You start removing so much fluid from the body that blood starts leaking from the capillaries or from the blood vessels, and you start getting what we call fluid shifts. And that can start changing your blood pressure, and that could affect the way that your heart pumps, and that could be dangerous to your health if you're not monitored, right? So that's where those recommendations come. Now, is there times in which you have somebody that's 6 foot, they have a bigger build and frame? 5 liters is actually not going to put them in that stress, right? So you could technically go over it. I don't ever really do much more than that. I actually can't tell you of a case right now. If you put a gun to my head and said, when was the last time you did over 5 liters? I don't remember, because I don't typically get that close. In the majority of patients, they don't have enough fat to get there, especially if you're operating on patients that have less than a BMI or body mass index of 30, which is the majority of my patients. And the reason that I use that number is because there's a lot of data to show you the safety profile. It's safe to operate on patients under a BMI of 30, which is considered the first mark of obesity. Once we go over 30, you're considered obese, right? And going over 30, it's exponential. The charts and everything say the risk of infection, the risk of wound complications, the risk of problems with surgery increases exponentially. And these studies were done specifically in plastic surgery. And so that's why a lot of my patients don't have higher than 5 liters to remove, right? And so I think with that combination, we keep it safe and we don't cause problems.
Okay, wow. I have an off-topic question that doesn't necessarily pertain to plastic surgery, but because you guys see a lot of patients, and I'm sure before you conduct these surgeries, patients have to disclose to you what kinds of medications they're on. Mm-hmm. Is there anything that you've been surprised to see? Because I know Ozempic is like through the roof, or Manjaro, all these drugs. Is there anything where you're like, damn, a lot of people are taking antidepressants, or a lot of people are on...
Yeah,
That's
you nailed it.
Antidepressants. Every single person is on antidepressants. And it's like sad, right? Everyone, you look at their medicine, their cholesterol is fine, their blood pressure is fine, but everybody's on Wellbutrin or something to make them be able to like manage their day. But to our old point, if everyone exercised, they wouldn't need to be on that shit.
That's what I was thinking. No, I hear you because I'm huge on a natural way of doing things.
Yeah.
And exercise is the natural antidepressant. It's just that people are either not motivated to do it or they don't have the time to do it.
Right.
And so it's much easier to get on and take a pill and just not think about it.
I'll tell you this. Exercise and fitness has been something that has been critical to my mental well-being, right? And
can't you tell?
Just a little bit.
I can see it.
But part of it might be a little bit of bigorexia, dysmorphia. But that being said, in all reality, the truth is that, so during my residency, during my medical school, I was exceedingly busy, right? It comes down to making it a priority, right? We have things that we prioritize in life. And a lot of times we don't even realize that we're giving priority to something like just, you can get on your phone and do 30 minutes of Instagram or TikTok like that. And you didn't realize that 30 minutes are gone and you literally all we're doing was scrolling. If you made just 30 minutes, whether it's the first thing in the morning, the last thing in the evening, wherever you can fit 30 minutes in to do exercise. And it doesn't even have to be in a gym. You can be doing it in your home. You can be doing body. There's so many great YouTube videos of just different things that you can do at home.
With your own body weight, not even machine. Yeah.
It's one of those things that a lot of excuses can be created, but at the end of the day, those are just excuses. Right? You can truly, if you wanted to, there's always time for at least 30 minutes to make that time in anybody's schedule, no matter how busy they are. And it doesn't even have to be every day. If you got 3 days a week, 30 minutes to start, then you can start kind of opening up your schedule to do it almost every day or 5 days a week and give yourself some rest days. But I think that is the one thing that a lot of people kind of create this, I don't have time for the gym, or I don't have time. Correct. And there's a lot of opportunities to do this without having to go to an actual gym and to do it at home within a short period of time.
Oh, yeah. You know what I started doing? Because, girls always go to lunch.
Yeah.
Girls always do. I mean, guys do dinner too.
Yeah.
But I started telling my friends, guys, next time we meet up, we're going to go on a walk.
Totally.
Yeah.
We're an uphill walk.
Yeah.
It's great.
And that's what we're doing.
Yeah.
And 45 minutes, an hour and a half, it just goes by and you move the whole time.
For sure.
And it's just little things like that. And to your point, what you said about just the half an hour, if you can fit it in your day, if you're meeting up with a friend, turn that into the thing, and they need to do it too.
Right.
So you're being a good friend by doing that.
For sure. Accountability is always great.
Yeah.
I think, like you said, priority just in anything. And I'm trying to teach my daughter this, but prioritizing your health. But prioritizing your self-esteem in the sense that, you know, if a guy wants to make you a priority, they're going to call you. If he's not calling you, it's because you're not important to him. And that's something that needs to be ingrained into people as opposed to making excuses. I don't have time to exercise. Oh, he was too busy to call me. That's crap.
Yeah.
It's all about making things that you value a priority.
So you guys call your wives every day?
Yeah.
Every second of the day, you guys are in contact.
I FaceTime my kids, 3 or 4 times a day. Right
No way.
Oh, yeah.
He does.
Yeah.
Totally. 100%.
I didn't know that.
Yeah.
I love that.
Yeah.
I actually moved to a house closer to the practice so that my family could be very close to me. And I sometimes, if there's a little gap in the schedule, I'll go home and see my daughter, or I'll go home and see the wife and hang out with them for a little bit. I think it all comes to what brings balance in your life, right? Because as a surgeon, I think one of the things that some people may not appreciate is that we have multiple stresses, especially in private practice plastic surgery. Not only do we have to worry about keeping the lights on, about feeding everybody that works for us, about taking care of our patients, about feeding our families, right? But at the same time, we also have to take care of ourselves to be able to take care of our patients, right? And so I think I'm of the mindset that I keep it simple. It's God, family, work, right? And so I put it in that order, and I make sure that I take care of my spiritual beliefs, I take care of my family, and then I take care of my work. And by having it, again, going back to priority and hierarchy, right? If you have all of these things organized and structured in your life, everything becomes a lot more simple, right? And at times, certain things take priority. Like I'll have patients that will have to take priority over my family because somebody needs me right now, right? And they're movable parts. But at the end of the day, for the things that are important to you, I think I agree with you 1,000%. You can't be too busy for something
You can't be.
that's important.
Like to make a call, to go exercise, you just can't.
You guys have a very wholesome vibe.
We've had our it's an evolution.
It's an
evolution.
Especially
We're a
for
work in
it's
progress
yeah.
if you talk to our wives.
Yeah, it's an evolution. We've all had our
Yeah.
days, not, you know.
Yeah.
Yeah. How did you guys meet?
So I do a fellowship with USC that are trained surgeons after they finish residency, and Nate was one of our fellows, probably the best fellow that we ever had, and I snatched him up because I knew I needed a partner. I needed a partner that wanted to do things that I didn't want to do, and do them well, and treated patients well, comes from a good family, like I know his parents super well. You know, all those things are super important. You can be a great surgeon, but if you're a dick and patients don't like you, who cares? You need to be a good person first, a good surgeon second, and then, you know, everything else falls into place. And I was really lucky to get him.
How often do you guys get compliments on like your bedside demeanor and your person? Like, seriously, because I told you that story of that surgeon who was telling me like, oh, well, you can do this and you can do that. And I was just like, fuck you.
Yeah.
You know?
Yeah. I think we hear it a lot, right? We hear it from our staff a lot, that patients, and I think it's not to say that that's what we do it for, because that's just our natural way that we interact with the world.
Yeah.
But I think it's really important. That's when patients feel comfortable and they trust you, and they're literally trusting us with their bodies. They're trusting us with their face, right? Something that they show to the public every day, right? And it's one of those things that's I personally, I think it's an honor when somebody's like, hey, I trust you to get a knife, cut me, stick a tube underneath my skin, suck out my fat, and shape my body in a way that I want, and then use that fat or give it to Dr. Chopra to transfer it somewhere on their body to change the shape. Like, if you think about it on those levels, it's pretty awesome what we are privileged to do and the privilege that people give us every time they choose us to be a part of their care team.
I mean, but listen, we all have bad days. I've gone into arguments with patients and things like that. I've got arguments with my wife, my kids. So we're far from being perfect.
Totally.
But I do think that we're in this unique situation where we can be very honest with patients because we've done so well that there's no pressure on us to do an extra surgery because we need to pay for something.
Yeah.
Right? That's a big thing when you go to different people's offices. they're going to upsell you on stuff because either they're money hungry or they need the cash. We're in this great luxury space where we've done very well for ourselves, and we're just going to tell you the truth. And we've always been that way, right? So if I don't think you need something, I'm going to tell you don't need it. You may still think you need it, but I'm not going to do it.
Oh, you won't even do it if you don't think they need it.
No. I had this great lady come in today, beautiful, probably like 6-7% body fat. She wanted some fat grafting to her breast, and she wanted her face done. She was 42 years old, beautiful. And I'm like, number one, you don't have any fat, so we can't do that. So that's a no. And I said, your face is beautiful. I'm not going to touch it. And I said, you can come in, if you need a little Botox, this or that, I'm happy to take care of that. But to do your actual facelift, you need to have a good 4 or 5 years. I'm like, you don't need it. And don't let someone talk you into it. Right? You're already pretty. Why try to do something to your face that you don't need? So I turned down a lot of people.
I actually had a patient yesterday that she's pre-op for surgery for something else. We're going to be doing something for her breasts. And she asked me to do, she's young, she asked me to do Renuvion skin tightening to her abdomen.
What is that?
Renuvion uses plasma energy and radio frequency, and essentially energy and heat that's specific to collagen to tighten the skin from below. It's typically done after liposuction or in combination with liposuction to get a little extra skin tightening. And so it's a nice device to tighten the skin. However, all of our devices, like we don't have a great endpoint for any of these energy-based devices. I can't tell you versus somebody else that your skin's going to be this much tighter and that person's going to be that much tighter because of the way that their skin is. I can tell you your skin's going to be a little tighter, but I can't tell you exactly how tight it's going to be, right? And this patient, I could barely pull the skin off of her muscles. That's how tight her skin was. And she was like, please do skin tightening. And I was like, no. And she's like, I'll pay for it. I have the money. I'll pay for it. We can do it in the surgery. We're doing surgery next week anyway. Just do it. And I was like, no, I'm not going to do it. I'm like, I'm sorry. Like the chances of something happening, even though the risk of something happening is low, is greater than the benefit that you're going to get from this device. And so in those cases, the same with Dr. Chopra, it's like, it's not worth it. And I think having a surgeon that can tell you no, I think is the most beneficial thing that anybody can have, especially when it comes to fillers and doing extra additional procedures, right? Because a lot of times part of our societies and a lot of things that they educate us is that you want to keep a patient in the practice, which I think is important, right? Yeah. You do a procedure on them. You want them coming back to the office for little laser treatments and Botox and non-surgicals, which is great. But if you have them continually coming back for filler and filler and filler and filler and filler, that's where you sometimes fall into this trap of people that start looking funky, right? And so having a surgeon that can see somebody and be like, no, that's not right for you, or this is not right for you. I've seen Chopra. This is funny. We walk in on a dual consultation. It's like a breast and body thing. And the patient had some giant lips. And he's like, stop putting filler in the lips. She wasn't even there for that. But he's like, stop putting filler in the lips. Because but anybody that walked into that room, that was the first thing they would have noticed on that woman. And so I think having that honesty with patients, I think is really, really important.
Did she appreciate when you said that?
She does. I'm very sort of blunt when it comes to stuff. I mean, when I come into a room and I smell someone smoking, I read in the riot act. Because that is probably one of the worst things you can do to yourself. And now you're in the plastic surgeon's office because you want to look better. Stop smoking.
Right.
Go drink some water. Go work out. Right. Your sort of perspective is totally skewed. If you're smoking and you want plastic surgery, it's like, no.
Yeah.
You know what I mean?
Yeah.
So, yeah. And so, you've heard me a couple times.
Yeah, I've heard those.
Did you tell someone stop smoking?
I'm like, dude, I smell it on you. You stink. You stink of smoke.
He literally, myself and my coordinator were in my office. She was telling me about some patient. And then I hear him through the hallway, 2 rooms over, you stink. You smell like an ashtray. Like,
No, I mean, someone has to be honest with people, right?
Totally.
You just got to be honest. I'm not trying to hurt their feelings.
No.
I'm not trying to do any of that. I'm just trying to just be honest and truthful to them so they can, live their best life, whatever that may be.
Good.
know?
Doctors should be honest.
Yeah. It's like,
Yes. How often do men come in for different procedures? Because I've been noticing a lot of men even openly talking about these things. They're talking about biohacking. I met a guy who like biohacked and lost a bunch of weight, but then he didn't like certain fat pockets and went to a surgeon to remove. And I'm just like, oh, guys are doing this stuff now? Like, what's...
well, yeah, I mean, I think great examples like Brad Pitt. He got a facelift. He looks great. So, I mean...
And we never know the doctors who are doing this stuff?
Oh, no, I do. But, but if someone that big is doing it, a lot of people are doing it. I think for me, most guys don't want to talk about their facelifts. That's one thing they don't want to talk about. But I've seen Nate do a lot of liposuction on guys.
yeah. I think percentage-wise, I still think it's a small percentage of the
Yeah,
practice.
very.
Like in total, I would say maybe 10 to 15% of my
yeah.
practice at most is male, right? And but that being said, I think that the guys that are coming in, at least for me with the liposculpting, are actually guys that go to the gym and do take care of themselves.
This guy also did.
Yeah. And they're guys that are wanting to take their physique to the next level. And they've already, and that's one of the conversations I have with everybody, right? Do you exercise? Do you work out? Do you take care of yourself? Are you eating right and healthy? Because this is not a solution for that. Liposuction doesn't remove that from the equation. It's a part of the equation, right? And so in these folks, we do ab sculpting and definition through the Atlas procedure, right? Which is that anatomically true lipoaspiratory sculpting. And I have some folks that are super lean already, but have just a thin layer of fat. And you can tell that they're dieting and doing all the stuff. And we go in and just add the definition. And the way that I do that is, so in your body, you have your skin, you have superficial fat, you have deep fat, and then you have your muscle, right? And if you watch a bodybuilding competition, the way that those guys get so lean, the deep fat is the first to go, right? And that superficial fat is normal. You need to have a little tiny thin layer of fat so that the way that the skin drapes on the muscles looks normal and there's no irregularities, right? And so in these folks, when I do this procedure, I'm actually removing as much of that deep fat as safely possible. And then where the abs edges are, where the muscles are defined, I actually do go up and create a little opening in the tissue plane between the deep and the superficial fat so that I can create a new, essentially scar attachment between the skin and the muscle at those definition planes, right? And what that does is it creates a natural highlight to their existing anatomy. So now, if that person were to gain weight, it's going to naturally expand and it's going to look normal. They're not going to look like they have like marshmallow abs because I left so much of that deep fat because that's all gone, right? It's just that thin superficial layer of fat that should be there because that's important to support the skin so that the skin's not wrinkly, right? And in doing it this way, we can really highlight and shape their anatomy and not give them these weird looking, Michelin abs that I've seen out there. And it's cool. It's just, there's not a lot of guys that are in that category. So it's a smaller percentage of folks that are interested in this procedure. But if somebody were like, big, heavy belly, there's guys that will go and sculpt abs on them, but it doesn't look right.
No,
right?
strange.
It doesn't match the anatomy. And so if you're heavy, especially for a guy, you should be leaner to be able to show that ab tone and definition. So that's when I'm doing these cases with them.
What percentage of those guys, I know this is a weird question, are straight?
It's actually a high percentage.
Okay, the only
Yeah.
reason I was asking is because, as a girl, I know what it's like, to want the male gaze or
Right.
whatever. And so gay guys obviously have that too.
Yeah. I think in that community, it's little less taboo, to have plastic surgery. I think that community is a little bit more open to the idea of plastic surgery because it's more common and it's openly spoken about. I think when you know, especially with the faces, you know, he does the executive deep plane facelift. And the hardest thing that he comes across is those executives allowing him to post their face.
Never.
They never allow. He gets incredible results, but they never allow him to post their face because it's part of their status. They don't want anybody to know, and it's still taboo in those circles.
I think that's an interesting point, right? Because it's so mainstream now, plastic surgery, you know, to your point, like everybody's doing it, that it's going to get to a point where it's not going to be as taboo. But at this point, I think certain men, certain higher ups, and even women, right? There's a lot of women who won't let me share their pictures. The majority of won't. So if I do, say I do, I don't know, 300 facelifts a year, maybe 20% will let me show.
Yeah.
That's even high.
That's even high. And that's with me begging.
Yeah.
Right? Because no one wants that. And I understand that because everyone wants to be like, oh, I'm naturally beautiful. Right?
Yeah.
I get it. But they're not. You know?
When you ask, are you like offering a discount? Like, how does that work? It's just, you're just like, hey, can I
No.
use this to show my work?
Well, in general, I said, you know, you look so beautiful. And a lot of, you know, patients would love to hear your journey, you know, and see your transformation because you look so natural. You look great. And that's how I approach it, you know. And then sometimes if I have to, I'll give them a little Botox or something. But in general, if they want to show and they're okay with it, they're more than happy to show, which is great, you know, and it really helps patients. And the beauty is the ones that don't want to show their pictures will talk to my patients. Hey, listen, I don't want to show my pictures, but if you have a patient that wants to talk to me about it, I'm happy to talk to them on the phone about it.
Okay, wow.
So they
that's
want to be
amazing.
involved. They just don't want people to know that they've had it done.
Okay, got it.
Yeah.
Got it. What's the most bizarre thing you've seen people come in for where you're just like, wow, that's so crazy. I wouldn't expect that. Or I mean, it could be a moment that you had alone or a time when, you know, you guys were both together where you're just like, wow, I wasn't expecting that, or I didn't know anyone would want such a thing.
I could tell you something that's super bizarre. That's the first thing that came to mind, but it actually wasn't in practice. It was in my training.
Okay.
It's just a wild story, a sad story, but a patient's husband, we got consulted. I was on the plastic reconstructive surgery service, and we got consulted because a patient was terminal, so she was going to pass, and he wanted her tattoo transplanted onto him. And the transplant and the medical team that was taking care of that terminally ill patient called us because they couldn't have the conversation with the husband, so we had to have it. And my heart, it's heartbreaking, but it was a very bizarre request. I've never heard of anybody asking to have somebody else's tattoo cut off somebody else's body and transferred to their body. I get where that was a very meaningful thing to that person.
Yeah.
And I understand that in that moment, like, I'm very respectful of that entire situation.
Of course.
But that's the first thing that comes to mind whenever anybody asks me that question.
That's interesting. I've had people who wanted like to put like horns on them and things like that. Yeah, they wanted to be like a character. And I'm like
body modification.
Yeah, like body modification stuff.
Yeah.
And I'm like, no, I don't do that. They're like, no, but you do a bunch of face work and this and that. I'm like, yeah, I'm not putting horns on you.
Oh, actually, you just reminded me about the horns. I had somebody about a year ago reach out to ask me to put pearls in their penis. So, like ribbed for their pleasure. Like they're implants.
Oh, in the skin.
Underneath the skin that are placed throughout the penis. But it's a body, that's more of like a body modification thing. But I think there was somebody on OnlyFans, one of these famous singers or somebody that I think it was one of the Latino guys has them and showed it on OnlyFans, and then like a bunch of people So I got a request for that. I was like, sorry, dude, that's not my vibe. I
my
don't do
specialty.
pearls and pearls and penises.
That's pretty good.
Yeah. That
Oh
was
my
another
God,
one.
what a world we're living in.
Yeah.
Yeah. I've had guys that were, I don't know, part of the mafia or something that wanted to change the way they completely looked because they were trying to hide out from people. So they wanted their nose done, they wanted their jaw shaved, they wanted everything to look totally different.
And did you help these criminals?
No, I didn't. I didn't help them. Yeah, and it's kind of scary, right? They come in and they're like, I want to look completely different. And I'm just like, why? They're like, well, I have things going on in my life. And then they go into it like, I'm part of the mafia or I was part of the mafia. And now I am sort of like witness protection program. And so I just want to look different. I don't want anybody to know where I am or how I look anymore.
You two, just do it and take the cash. I'm kidding.
Yeah, right?
Untraceable.
Yeah.
It's crazy. Wow.
Face Off, like that movie.
Yeah, exactly.
There's a movie?
There's an old movie. It's called Face Off.
John
that
Travolta.
John Travolta. They switch his face. It's a
You're too
face
young for John
transplant.
Travolta.
No, I know who John Travolta is. Grease.
Grease, yes.
There you
Yeah.
go.
Yes, there you go.
There's an old movie, Face Off. You could put it on the bucket list.
Yeah.
Do you feel like the celebrities that come to you are a little more like neurotic about what they want, or are they just like, what's the difference between people who are very forward facing and people who aren't? Or do you even notice that a difference?
I do. I feel like there's so much pressure on these people that are forward facing, right? They see themselves in the camera every day. And I see a lot of these young actresses, or especially people on the news, that want to get something done and they don't know what it is, but they feel like they're looking old. And there's a finite period of time that you're sort of the eligible girl in Hollywood or on the news, right? So everyone's trying to stay in that zone. And because of that, if they see a little wrinkle on the side of their neck or some wrinklings below their eyes, they want to take care of it. And they're neurotic about it because their job depends on it. And that's the hardest thing, because you have these beautiful women that are coming in that really don't need anything, right? Because they have a little bit of wrinkling, but it's age appropriate, right? And so when you start modifying them, they're going to start looking done. And that's the issue that I have with these, actresses and, news people that are coming in a little too early. They want to stay ahead of it, and I think that's great. And I think the best way to do that, again, is the basics. Exercise, a great skin regimen, and a great diet. Those are the best things. But they are neurotic when they come in. And I just feel bad for them because, they seeing their career, they're seeing the next pretty girl come in, right? So they want to compete with them.
I have a question for you guys, not as surgeons, but as men, because when I spend a lot of time on the internet, like a lot,
Like
my job.
Porn.
No.
It's a valid question.
Fair question, but no. Just in general, social media on Twitter, X, whatever you want to call it, Instagram, TikTok. And I see the way a lot of men speak about women, or you see a lot of divorces where the guy leaves a girl for a younger woman. And so I think it's not just Hollywood that's making women fear getting older. It's, oh my God, I could lose my husband, or I could lose my boyfriend, or whatever. And I wanted to ask you, as men, how prevalent do you think that is? Because you have other friends you guys are successful, you have other friends who are successful and doing well. And do you feel like looks matter that much? Like, does it really matter that much? Or is it just that the appearance of beauty needs to be there and the youth factor, doesn't matter as much? I know those two are linked, but I've seen so many beautiful older women too.
Yeah. I personally think that all relationships start with an initial attraction,
Yeah.
right? Like before you even talk to somebody, you see them, right? When somebody's across the room, you identify them, you see them, and that's where it starts, right? And so does beauty play into that? we'd be foolish to say it doesn't, right? Because a lot of what we are ingrained genetically in terms of our beauty and concepts and understanding, yes, society shapes a lot of it. But genetically, at the end of the day, humans are here essentially to procreate, create kids, and move on, right? That's what the animal kingdom does, and that's what everybody does, right? And so in that basic concept of it, I think that when you're looking at somebody's physical fitness or shape, or subconsciously something that you're not necessarily thinking about is what is their ability to procreate, right? And that's where I think it basically starts. Now, there's a lot of things in society that have changed that. So I don't want to detract from how we've evolved as a society and kind of remove some of that. But I think when you go back down to the core of that first glance, that's the primitive brain running, right? And so, you know, is there a higher propensity of men finding younger women? And I think, yes, that does happen because they do find younger women more attractive. But at the same time, I don't know. I think it's an individual question, right? Because like I'm in an industry in which I'm around a lot of very attractive young women all day long. And maybe it's unique to me, but I really only still have eyes for my wife. And the older that I get with my wife, the more beautiful I find her, right? And my wife looks young. She looks great. She's awesome. She takes care of herself. But I think there is something about growing old with somebody that is different and special. And that's just my personal opinion. Everybody approaches this differently. But I think to answer your question, I think there is a primitive part of our brains as men that goes back to the caveman that's like, ooh, I can make a baby with that person, right? Even though that's not the actual thought process, I think that's the primitive brain reacting.
I also think it has to do with self-worth and what you think other people are perceiving you. Like when you see a older guy with a young, beautiful girl, what do you think?
He's rich.
That's right. That's right. And so I think when people see you out there, there's a perception and you get judged, unfortunately. Like when I bring my wife to places, she's beautiful. Like, oh, yeah, that makes sense. You're the plastic surgeon, you got a beautiful wife, right? There's these innate things in society that happens. And I think that's one of them. You see an old guy, a young girl, rich, right? And you're like, he must be a baller.
Yeah.
Because there's no way he's going to get this girl.
I mean, even younger guys these days, it's crazy how much of, when I talk to them about how they choose certain girls to be their girlfriends or whatever, some of them talk about like follower count or
it's crazy.
I love that my guy friends try to hit on my girl. Like that just gives me such a confidence boost or whatever.
So it's self-esteem,
and,
like I'm saying.
Yeah, and so it's crazy how much of it is, oh, I like these qualities about this girl, and how much of it is this girl helps me signal to other people that I am of value.
Totally.
That's it.
I think you nailed it there too.
Yeah.
Yeah. And that's kind of so what I was speaking more was the initial process.
Yeah.
But this is the decision process, right? And that's the higher level thinking that the brain comes in and is like, oh, does this girl have followers? Does this girl have status? Is she going to look good on a red carpet next to me? You know what I mean? Like all of these things that, you know, are not essentially important, but we give importance to them because we worry what other people think about us.
That's why I married my wife.
Why'd she marry you?
That's a question.
That's a great question. We all ask ourselves that in the office.
I ask myself that every day.
No, he's a good human being. He's a great dude, and he's a great dad. That's why she's with him.
Yeah, no, but I mean, both of you are very good guys. Okay, I asked this question to every single person that comes on my podcast. And the reason I ask it was because I realized it's so hard for people to decide out of all the messages they want to share in this world, what most urgently needs to be said and what message is the most important to them. So I came up with this scenario. And we'll start with you and then we'll end with you. So you are at the Oscars for a documentary about plastic surgery that you guys made together. And they call out the nominees, and then they announce the winner, and it's you guys. And you walk up to the stage, you both thank everybody that you need to thank, and then there's about a 45-second to 1 minute time slot where you can say whatever you want to say. It's going to be recorded. There are going to be headlines. It's going to go viral on Reels, Shorts, TikTok. What are you going to say in that 45 seconds? Like, what message is so important to you that you would want to say that? And also, I think, consider that you're also parents.
Right.
Think about every role you have.
I think at the end of the day, plastic surgery is an opportunity for people to change and adjust their bodies to a certain manner. But at the end of the day, the most important thing is to love yourself. Love yourself, respect yourself, and hold yourself to a high value, no matter what you look like, no matter where you come from, no matter what background you have, because that is going to give you not only true happiness, right? Because what we do helps with that aspect of life, but true happiness is internal. You have that before you come into our office, right? And we can tell the patients that do have that, they do way better than those that are seeking it, right? And folks that are seeking happiness need to find that before they're seeking plastic surgery, because plastic surgery will not bring you happiness. It's just another layer in the life, in the journey of people's lives. And so I think loving yourself would be my message.
Love. That's so beautiful.
I think, yeah, I kind of stole mine, what I was going to say, but I think that's it. And
I was
think,
talking to Emma there.
I think that same thing. I think, and the biggest thing nowadays, I really do think, besides loving yourself, is just be kind. That's it. Everyone needs to be kind to each other. We don't know what you're going through. I don't know what he's going through. I don't know what you're going through. Just fucking be cool. Be kind to each other. That's it. We'll be in a much better place, holistically everywhere, if we're just kind. We value ourselves and we value others.
Beautiful. I love it. Thanks for coming on.
Thank you
Thank
for
you for
having us.
having us. It was awesome.